everyone, welcome to Eve Keeps You in the Know vlog. Thank you for joining me today, and I hope you will enjoy this video. Today's topic is about antibiotics' harmful effects. Please note that all information published by Eve Keeps You in the Know videos are carefully researched facts and produced by no other than myself. My channel does not use artificial intelligence writing tools like ChatGPT to automatically generate contents. Let's dive in. As you all know, antibiotics are one of the highly used medications to treat conditions such as painful strep throat, ear infection, itchy skin infection, and urinary tract infection, UTI for short. Professional healthcare providers prescribe antibiotics to eliminate and prevent bacteria from reproducing and growing. Antibiotics cannot be interchanged from one infection to another. Antibiotics do not work against viral infections such as colds, coughs, and COVID. In this video, I will give you only the common infections treated by the highly used antibiotics to make this video shorter. Mentioning other types of antibiotics for other conditions will entail more information to discuss here and will make this video longer. They are also important, but I don't want to bore you with a long video, perhaps in the future videos. Here are the common antibiotics used. Number 1, ciprofloxacin is used for older people for urinary tract infection, or UTI for short, prostate infection, bronchitis, pneumonia, sinus infection, skin infection like rash, swelling, redness, inflammation, or abscesses, bone and joint infection, infectious diarrhea, gonorrhea, typhoid fever, plague, and anthrax. Ciprofloxacin may not be appropriate for all these infections I mentioned. It depends on what germs are causing the infection. Bacteria in some locations may have developed resistance to ciprofloxacin and will be less effective. Next is Augmentin. Augmentin has a generic version called amoxicillin. Augmentin is used to treat sinusitis, pneumonia, ear infection, bronchitis, also skin infection, and UTI. Amoxicillin is a penicillin antibiotic that fights bacteria in the body. Augmentin contains amoxicillin and clavulanate potassium. Next is Flagyl. Flagyl is an antibiotic used to treat bacterial infections of the vagina, stomach, liver, skin, joints, brain, and spinal cord, lungs, heart, or bloodstream. Flagyl is also used to treat a sexually transmitted disease caused by a parasite. Next is Bactrim. Bactrim is used to treat ear infection, urinary tract infection, bronchitis, traveler's diarrhea, shigellosis, and pneumocystis pneumonia, or PCP for short. Pneumocystis pneumonia is a serious infection that causes inflammation and fluid buildup in the lungs. It is brought on by a fungus that spread through the air. Bactrim has generic version called sulfamethoxazole and trimethoprim. Bactrim contains a combination of these two antibiotics. Antibiotics can cause kidney issues. The kidney is our filtration system. Certain antibiotics can damage kidney cells. If you have a pre-existing kidney condition such as renal failure and are diagnosed with infection, make sure your healthcare provider is aware of the right antibiotic to use, which they should know. That will not severely impact your kidney. NSAID. If NSAID is taken for a prolonged period for pain and fever, can cause damage to your kidney and liver. My website, livelifewellall.com, has a topic that discusses meat products raised in cages for commercial use or food for humans. I'm talking about farms raising pigs, cows, and fowls in cages. Animals raised in cages are given antibiotics to prevent them from getting sick or spreading illness to other animals in the cage. People like you and I also ingest the antibiotics given to these animals. Eating these non-organic animal meat products on a daily basis or weekly basis, a person can develop a tendency to become immune to antibiotic treatment if diagnosed with an infection and needs to be treated with an antibiotic. If you've been prescribed an antibiotic, you can protect yourself from the harmful side effects. Antibiotic is known to negatively impact your metabolism, increase your risk of insulin resistance. You might gain or lose weight. It will lower your immune system. It can make you susceptible to a disease or other illness. You can effectively counteract the side effects by eating foods that increase the good bacteria in your gut. Boosting the amount of your good bacteria will strengthen your immune system. Yogurt and fermented foods will provide the probiotics needed in your gut. You can also take probiotic supplements. Keep yourself hydrated with plenty of water to flush out toxins and reduce the side effects of the antibiotics. Consume a diet rich in fruits, vegetables, and whole grain to support overall health. Our kidneys play a crucial role in removing antibiotics and other drugs from our body. For antibiotics to be effective and safe for kidney health, it is important to use them correctly to avoid adverse side effects. Your professional healthcare provider should prescribe the correct antibiotic for the infection you were diagnosed with. Thank you all for watching. If you liked this video, please give it a thumbs up and subscribe to my channel. Visit my website at www.livelifewellall.com. Stay well everybody and see you in the next video. Bye for now.